Right now, we have 5.5 million people that are food insecure in Texas or at risk of hunger. Unfortunately, 1 in 4 children in Texas are at risk of hunger. So the problem is very prominent. It's one of the hidden problems that you don't expect to see in a state that's done as well as we have through a very difficult recession. We're typically ranked right up there in the highest amount of food insecurity in the country. Right now we're ranked second. Oftentimes we've been in the top 5 in the amount of childhood food insecurity. So we're very high as a state. Dramatically. Unfortunately, it's going to directly affect families who are families that we would consider the working poor. Families that are typically making $24,000, $25,000 per household when they have maybe 2 parents that are working and several kids at home. I've worked in low-income communities in Washington, D.C., and Birmingham, and Waco, and San Antonio, and for the most part, families are experiencing poverty for the same reason. So it is a systemic issue. But the progressive response has typically been that we need to have a federal response. So we create federal nutrition programs, we create poverty-related programs through the federal government to address the issue. What we're seeing is that as a country, we may not necessarily have a stomach for that. That we as a country are fiercely independent, and we prefer a more localized response. On the other side of the coin, our conservatives typically have seen the problem being the fault of people who are poor, that they're purely making bad decisions, or that poverty doesn't exist at all. And so we know that those two roads aren't leading us to the place where we want to go as a country. So we really need to come up with a third alternative. In the last several months, almost for the past maybe 18 months or so, we've heard a lot about the Supplemental Nutrition Assistance Program, particularly, and about how there are a lot of fraudulent activities associated with it. We also see that it has a very high percentage of participation right now. Over 45 million Americans are on that program, and people think that is a really negative thing. The reality is that if we didn't have that program, our recession would have been much more difficult. We forget that the social safety net was established to prevent another Great Depression. And the reason that we have poverty rates at maybe 15 to 18% as a nation, rather than upwards of 25 to 50%, is that social safety net. It's doing exactly what it was designed to do. Texas has traditionally, over the past several years, left up to $6 billion a year in federal nutrition program resources on the table. That would have huge economic impact on the local community level. Most of those resources are left on the table for the Supplemental Nutrition Assistance Program, which provides resources to families that are predominantly working to go and purchase food in the grocery store. We jokingly call it trickle-up economics, and it's where you're investing in the lowest income community members in your community, and they immediately reinvest that money in their local grocery store, which creates working class jobs. Whenever you have working class jobs created, that necessitates middle class management jobs, and the money trickles up to the owners of the company. There are churches and faith-based communities and nonprofits working alongside state agencies and the federal government to try to address this issue in every corner of the state. But what we've learned is that they're so busy trying to address the need that oftentimes we're sadly duplicating services and we're unable to address the gaps of service that exist. So the Texas Hunger Initiative was born to try to build community-based collaborations, state-based collaborations, to get all of the different entities working on this issue to address it collectively as one big giant team. And as a result, we're seeing a marked improvement in participation rates around the state in public and private programs for particularly children who are missing meals.